So hello there and welcome to the Tier 1 Therapy Team's Lower Back Pain Workshop. It's basically Stuart and Ollie taking you through this today, and we're going to learn quite a few things about the lower back and what you can do at home and anything to alleviate concerns really that you have about your lower back. So without further ado, we're going to crack on. Ollie, say hi.
Hey guys, I'm here. I'm in charge of pushing the buttons.
Perfect. So for those of you that don't know us, there's two therapists at Tier 1, both sports therapists. My name's Stuart Turner, and I am one of the co-founders here at Tier 1. My business partner, John, does all things gym-related and nutrition-related at Tier 1. But really, it's Ollie and I that do everything therapy-related. So a little bit of background about me. I don't want to talk too much about myself, but I graduated in 2006 from the University of Hertfordshire, which is a great university. And I've since built up and accumulated 14 years experience in private practice. And we kind of pride ourselves here at Tier 1 of always developing. So you can kind of look at it two ways. 14 years experience repeating the same thing. So in essence, you can have 1 year's experience and repeat it 14 times, or you can always constantly develop and improve as a therapist, and we try to be the latter. So kind of our work's taken us all over the world, from America to places like obscure places in Poland and other places like that. So we're always learning, and it's something we've always encouraged Ollie to do since he's been on board as well. But particularly my professional interests, I love to treat lower backs and I love to treat hips, having extensive hip problems myself over the years. It's a real keen area of interest for me. And I love to work with combat athletes. So as you see my picture there, I've got a couple of future stars in the world of like UFC and stuff like that. That's really my personal area of interest. And I love to work in sort of the areas of strength and conditioning and developing that side of it and looking into rehab and performance. Ollie, over to you.
Yeah, so my name's Ollie. I graduated in 2015, so I'm few years younger than Stuart, but I've been working at Tier 1 for a large portion of that time and take a lot of my learning from the guys there, and sort of been and about doing other bits and bobs before them, but really found sort of a home at Tier 1. My professional interests, again, big fan of the back. That's always really good. So I want to say fun to treat, but I'm not sure that's the right word, but it's enjoyable to do. And shoulders and knees as well are really sort of, there's a lot to do with those sort of injuries and stuff like that. So that's always good fun to work with. I've got other things going on as well. I work with a rugby club, a big part of a CrossFit gym as well, locally here in Northampton. So I work with those, keeping all their athletes fit and keeping them all moving. Particularly in rugby, there's a lot of injuries, as you can imagine, lots of sort of contact injuries and whatnot. Other things I'm really interested in is sort of looking at pain management and how pain works, and really integrating sort of sports medicine and athletic performance, which I obviously show through working with the different teams and stuff. We're quite involved, and I've learned a lot from Stu as well, which is really good. So enough about us two. Let's get into this presentation, shall we?
Yep. So obviously, if you like Harry Potter, you'll know immediately who that is. And it appears that Hermione Granger's had lower back problems. But for the guesses, for most of you, this is why you're here. So I'd imagine the vast majority of you watching this right now have had some form of lower back problem. And we can pretty much guarantee that if you haven't personally experienced lower back problems, you will know someone in your immediate friendship group or family group that has. It's so prevalent. It costs the NHS billions of pounds every year, and is responsible for so much time out of sport, out of work, and things like that. So we're going to talk to you a bit about, obviously, moving on from this, how you can fix it and everything. But yeah, I imagine for most of you watching this that you're all putting your hands up just like Hermione is right now.
So
yeah, running through obviously what to expect from today's workshop. Ollie's going to take you through a quick quiz, a true or false quiz. And obviously we're all in COVID lockdown at the minute. I'm probably all sick to death of quizzes and that, but it's always good to know a little bit of true or false about lower backs and everything like that. So it's all about education. That's one of the biggest ways to actually combat lower back pain, is through education, because it alleviates fear, alleviates anxiety and everything, which are key drivers to pain, believe it or not. So yeah, we're going to go through that in a second. Ollie's going to take you through that. And we're then going to discuss the common belief issue. So there's quite a few issues around like people's thought process and beliefs to like what is happening with lower back pain and why and everything like that. And then we're going to talk to you about the singular diagnosis dilemma. Ollie will take you through that in more detail, but we're kind of obsessed in this country with getting a singular diagnosis and labeling a problem with as just one particular problem. And as you'll find out, you really need to move away from that to form an effective treatment plan. I will talk to you about pain. So say this 3 times when you're drunk. The perception of pain is a pain to explain. You're going to learn about what pain really is. And once you kind of know that, you know not necessarily to fear it as much. And then contributing factors we're going to discuss that in a little bit. And kind of from the other issues that we're going to talk about, the common belief issue and the singular diagnosis dilemma, you may or may not be thinking, what the hell is going on if it's not what I've truly believed up until this point? So don't worry if you are thinking that. We will explain all at that point there. And then we're going to talk to you through what we see in our clinical presentations of our athletes and clients. And hopefully by that point, we've not bored you to tears and death by PowerPoint. We'll talk to you about what you can do at home, and you can then have access to our free download, back pain download. So over to you, Ollie.
Yeah, nice one. Cool. So true or false then? Let's start a nice easy one. So 80% or more of people will experience back pain in their lifetime. There was a bit of a hint earlier on in the presentation about this bit, but that is true. So yes, 80% or more of people will experience some back pain in their lifetime. We could probably make that number 100% if we were to say that if you or someone you knew struggled with back pain, because it's just so common everywhere. The next one would be, if your back is hurting, you should stay in bed and avoid all exercise. Again, this one gets sort of, people aren't ever sure on this. We do get asked this one a lot. I've been in bed resting it. Is that the right thing to do? Not necessarily. It's more likely to be false. It's one of those things you read about quite a lot. Just rest. But for the back, that may not be the best thing to be doing. And a little extra fact there for you that I forgot was there is, did you know some studies say spending a week in bed reduces your strength by up to 8%, which is quite a lot if you spend a lot of time in bed. The next one, extreme back pain means there is an extreme amount of damage. So again, logic would dictate if there's a lot of pain, there's a lot of damage, right? That would be false. We will talk about pain a bit more later on in the presentation, but pain is not the best way to try and assess the amount of damage that's present with an injury. It can be very misleading sometimes. So the next one, back pain comes from the back. This might be a bit of a trick question, and also plays into that fact we talk about pain, but that is also false. Back pain does not have to come from the back to be classed as back pain. Again, we'll talk about that a bit more later on in the presentation. So when you have back pain, it means that your back muscles are weak. And this is a very common one we hear all the time. Ollie, I've got a bad back, my back's really weak. I've been told my back's really weak, etc., etc. You can probably think of 10 different variations of that statement. But that is false. It's quite rare for the back to actually be very weak. Again, we can talk about that later on and try not to spoil too much of what's coming up. But yeah, your back is not weak. Very, 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 very rarely is actually weak. Next one again. So back pain comes from a singular source. Again, this one kind of teaches on that whole singular diagnosis dilemma that we're going to talk about again later. Those are themes to these questions, as you can imagine. We're sort of trying to feed into the rest of the presentation. But again, this one is also false. Back pain rarely comes from just one thing. There's normally a combination of factors that will be affecting the back pain. So over to Stu now, the common belief issue.
Yeah, so yeah, well done, Ollie. For those of you that got full marks there, do contact us for your winning prize.
Yeah.
But
there were some hints going on during that, to be fair. So
yeah, I mean, the biggest takeaway for me from that little quiz was like the first one, Ollie. So yeah, 80% or more of people will experience back problems within their lifetime. So immediately strikes me there, like if you are suffering from back pain right now and you're here watching this, you're not alone. So that's a real key thing. You're not alone. It's so prevalent, particularly in modern society. Excuse me. And there's so many reasons for it. So yeah, don't think that you're alone in all of this. So if you need to reach out to us and talk to us about it, please do. But yeah, you're not alone. But yeah, the common belief issue then. So moving on, there's this sort of common belief issue, not just in the UK, but sort of worldwide of people. And our job is really to educate you beyond that. But this common belief issue is that back pain is associated to just one singular area. So people think my back pain is stemming from my, excuse me, is stemming from my lower back. So therefore, obviously, it's the problem in my lower back that's occurring. So we challenge that belief issue. So because it kind of leads you down this road that if your back pain is associated to just one area, you simply need to isolate and strengthen that area to get better. It's a bit like saying, I have an Achilles problem, therefore I'm just going to solely work on my Achilles to make it better, when there's so many of the possible contributing factors that you need to look at. So this is sort of why we're challenging this issue, that back pain is not always associated to just the lower back. There's a lot of things going on. The human body is a system. And as we're going to explain, because like I say, once you start getting the blinkers on and going down to this, my back pain is associated to my lower back, I'm therefore going to isolate my lower back through my rehabilitation and just strengthen that one area. It's kind of a flawed concept, as you'll soon begin to see. So moving on, Ollie. Yep, so this is what we're alluding to. It's a flawed concept because the lower back is, the body is a system. So for an effective rehab protocol to take place and actually eradicate a problem or pain, you have to look at this body as a system. And I'm going to play devil's advocate here a little bit. I'm going to say, if you've got a back problem and you believe that it's just associated to the lower back, and you start putting an extra load of workload onto your lower back, what if the lower back was not in fact the culprit, but is in fact the victim in all of this? What if the lower back is being overworked and it actually needs a break? And therefore, putting a load of extra workload on it in the form of trying to isolate the lower back, strengthen it, make it work even harder? Are you then overloading the back? Are you putting a ton of extra workload on it? Is that going to help? So this common belief issue, if you start to get the blinkers on and start to go down that road, it can be quite problematic in that it can actually feed into the problem as opposed to sort of addressing the problem.
I think that's quite a sort of a very popular belief, isn't it, during all sort of rehab, that if an area is weak or it's got pain, you just add strength to it, right?
Yeah, and obviously strength has been it's a huge area of any rehab program. It's a huge area of any athletic development program, we know. But you have to start asking yourself, am I strengthening the right area? Am I targeting the system? Or am I overloading the area? So obviously in any rehab program, when you're starting to add strength, the first question has to be, how much strength is enough? And am I targeting the right areas? i.e., am I targeting the system, as we're going to explain?
Awesome. So now we're going to look at sort of what we call the singular diagnosis dilemma. So what on earth is this? Well, this is where, you just pick one thing to attribute to all the problems. So your back pain is a result of one particular thing. Now, this line of thinking is really great for hospitals and insurance claims. But for the most part, that's not really what you as the person or the person sort of struggling with the back pain cares about. You don't need to be a tick box, you just need to be out of pain. So that's where trying to label everything is a problem in sort of treating the back. And it doesn't always lead towards the most effective treatment pathway. And that's exactly what you need. Because if, for example, it was just, they told you it was a disc bulge that was the problem, and they just removed the disc bulge, that doesn't necessarily mean that that's the most effective way to get your back better, or even to remove your pain. That could potentially make it worse or what, but that's something we will allude to slightly later on as well. And as Stuart mentioned in the previous slide there, that the body is a system. So you can't just pigeonhole this issue into one tick box. It doesn't exist, this sort of single diagnosis that people are potentially looking for. It's very easy to just say, oh, I've got a disc bulge and that's my one problem. That is unfortunately not true. But yeah, the body system is really important. And that's the thing that we talk about a lot at Tier 1, and we look at things without the blinkers, as you'll come to hear us say quite a lot during this presentation, but we like taking our blinkers off. But yeah, the main parts of this really are sort of this singular diagnosis doesn't necessarily exist, and what has happened within this system to result in this singular issue. So there's lots of things going on within the system at all times. So it's a case of trying to address those problems that will then fix this sort of singular issue in inverted commas. Not that you can see me, but I'm doing the thing with your fingers in the air, but the singular issue doesn't necessarily exist. And is there a more effective treatment pathway that's potentially less invasive and less risky? Particularly if you start talking about operations on the back and the spine and stuff like that. They're always very scary for people to have to go through. But yeah, moving on. Blinkers.
Fantastic. Love that picture.
Yeah, we've got a little scenario to work through here for you guys, so please bear with us. Our acting skills may not be the most effective over FaceTime and Zoom, whatever. But so in this scenario, we're just going to play back and forth through some sort of common conversations that we have. So what's the diagnosis, Doc?
Well, from looking at your back, you have facet joint compression, which is causing all of your issues. Therefore, a simple manipulation of your lower back at our clinic is exactly what you need. Crack. We now need to sign you up to our 6th monthly plan for regular manipulations, and this will cost absolutely enormous amount of money. So is the problem solved by doing that? So going back then, with this sort of exactly what we've just talked about, I believe in this scenario, the common belief issue, so somebody has then got the blinkers on and they've fallen into the trap of this common belief issue that the lower back is the problem. So I'm just going to look at the lower back as a therapist. I'm going to diagnose something within the lower back. So I've given you a singular diagnosis, and now I'm going to manipulate you and sign you up for repeat sessions, which will benefit obviously the therapist greatly and may or may not get you out of pain. So in our sort of our world, we operate a little bit differently, and obviously we question whether this would solve the problem or actually and address the system-wide issues. So yeah, moving on, Ollie. So yeah, we question whether something has been missed in this. So blinkers off assessment. So blinkers off. So Ollie, let's go through our sort of secondary scenario.
What's the diagnosis, Doc?
Well, from your total body assessment, we have identified a number of factors that are potentially contributing to your problem. This is great news because we can now systematically address them to get you moving forwards and out of back pain.
But I was told that I have a facet joint compression. I just need a quick manipulation and I'll be better. You always sounds like a lot of hard work.
Well, yes, you do have facet joint issues and compression, but this is the result of a wider problem. By merely manipulating the area, we are simply treating the symptoms of the problem, not the root cause. This way may result in repeat visits and prolonged issues as the problem isn't being addressed. We need to address the causes so these issues do not come back again in the future. I.e., do it right, do it once. And that's sort of the sort of way of thinking that we adhere to. So we're not trying to sort of brag here or anything like that. We're just trying to say that and reinforce this pattern that the body is a system. And if you can actually address the issues within the system, you can A, save yourself a lot of money, but B, you can get out of pain a lot quicker. And those problems should, in theory, never come back.
Yeah, and we sort of hear this word compensation a lot, don't we, from all sorts of things. And by targeting the whole system, you can sort of undo a lot of those compensations that have crept in. And we've had on other occasions before, Stuart, where people have said, oh, my back was sore and I've also got sore knees and stuff like that. And then by looking at one thing, we've helped solve the other thing as well, which is great.
Absolutely. Like I say, the body is a system, and if you restore balance within that system, in theory, you can tidy up a whole ton of issues. So if you've got a bad back and a nagging hip, for example, just by eradicating and addressing a few systems within the core and sort of that region and beyond, and addressing what you've identified from the assessment, we often find that people's hips just naturally tidy up as well.
So in our two scenarios there, this wonderful person has obviously chosen the second option there, which is in our eyes quite clearly the superior option. But we'll work this again. So let's do it your way. What is my problem?
Well, we can see from our conversations that your sleep has been really poor these last few weeks, and you are reporting higher than normal levels of stress. From your physical assessment, we have also identified that your pelvis and rib cage have been driven into a position that is causing your core and hamstrings to be overpowered by your lower back. And this, we believe, is what is causing the compression of your joints and within the spine. Now, this may sound really complex, but the long-term solution is really, really simple. If we can restore the position of your rib cage and restore the position of your pelvis, we can get your core and hamstrings to do a little bit more work. And the result is a natural decompression of your lower back. And obviously from that factor, from all of this, we can then systematically help you resolve the underlying issues regarding your sleep and stress levels, as these may also be a driving force behind your back problems. So hopefully from that slide, you can see really that we're addressing everything that we found within our assessment, and we're treating the body as a complete system. So we've identified a number of factors that could be causing the resulting facet joint compression. And obviously if we sort of start to systematically address these one by one, you get a natural decompression of the lower back, and you get a much better and healthier sort of bodily system. And the issues naturally go away. If you don't do it this way, and then you just get your blinkers on and you go and manipulate those facet joints, yes, of course, you're going to cause a rapid decompression of them, and you're going to get sort of temporary relief. But because you haven't addressed the driving factors behind them, so the position of the pelvis, the position of the rib cage, the stress, the poor sleep, all of those issues, then over time, and believe it or not, it's often very often shorter than you think, that compression of the facet joints just comes back. And obviously then you have to have it manipulated again, get temporary relief, and then the compression comes back, and you get stuck into this sort of vicious cycle of repeat sessions to your therapist at a great cost.
Yeah, I think it's also worth saying as well that we're not saying that these problems don't exist, and that they do exist, but it's how they're caused and how they're treated is the real sort of gripe that we have sometimes, particularly like you say with things like manipulations and operations and stuff. They don't actually fix the underlying problem, and they just happen to come back again.
Absolutely.
We've seen on many occasions where people have had different operations, different releases, decompression, etc., but never actually solved the original problem. It just solved the sort of result of that problem. And that's sort of what we're going to go on to talk about now, and sort of the method behind the madness. We are aware we don't use too many big scary words and scary sort of diagnoses and stuff like that, but there is a reason all these things like joint compression, like disc bulges, herniations, and like sciatica occur. And these are the types of conditions that you don't want to just be trying to label and put into one box, because generally with all of these things there is a problem within the system that causes them to happen in the first place. So these could be sort of issues within muscular relationships, because muscles work as pairs. So if one muscle isn't pulling its weight, you can rely upon the other one, which over time is going to cause lots of imbalances. And depending on which muscle these are, you'll then create lots of positional changes, which links quite nicely onto option number 2 there. So these distorted muscular relationships then lead to positional problems, which can then lead to compressions, can lead to bulges and sciatica. Stress is a really, really big driver of these as well. Well, the last stress and breathing, we're not going to cover in too much detail today, but we'll do in later presentations and things like this. But I'll talk about them briefly now. And it's how these two drive the muscular problems and drive the positional changes as well. And like I said, we'll really cover those in detail because they need a whole presentation to themselves, don't they, Stu?
Absolutely, yeah. So yeah, I mean, what you have to understand today, we're going to talk about sort of position and how position affects sort of these issues above. So the position and how it affects joint compression in the lower back, position, how it can affect disc bulges in the lower back, and position and sciatica and stuff like that.
Yeah.
Like you say, stress is a mammoth topic, and obviously the way we breathe comes hand in hand. So stress and breathing strategies come hand in hand with position, but we have to break them down. Otherwise, like I say, we'll be here all day with you guys, and you don't want that.
As great as you are.
So let's break this down and simplify the science then. Again, Ollie just hit the nail on the head. We don't want to use too much jargon with you, terminology and that. So we're going to talk to you in real terms. So hopefully you can understand exactly what's going on. But obviously, if you don't, there's obviously just fire away at questions with us. So you can always message and stuff if there's something that you haven't understood. But this one is for me. This is a tongue twister now. The perception of pain is a pain to explain. And obviously, again, so we talked about common belief issues and singular diagnosis. There's also a belief issue around pain, that it is actually something physical. And the reality is pain is not physical, and it is entirely unique to every individual. So pain is almost like an experience, and that experience differs between every single individual on the on planet Earth. Sorry. So what exactly is pain, and where does it come from? So the first thing you need to understand is that pain is nothing, it's not physical. It is actually an output of your brain. And it may surprise you now, but if I told you of the approximate 46 miles of nerves in the human body, none of them can produce pain. They can only contribute to the experience of pain. And because of that factor, we liken pain to a burglar alarm. Then just because a burglar alarm is going off, it does not mean there's a burglar in the house, not necessarily anyway. But again, it is a warning system, just like an alarm. And if it is going off, you have to check if there is a burglar in your house. That's the first thing you have to do. Is like get up 4 o'clock in the morning, run downstairs, and see if there's anybody in your house. And more often than not, it's not. So therefore, pain does not equal damage. If it's an output of the brain, if it's nothing physical and it's just a warning system, it does not necessarily mean you have damaged your back. So if you have an extreme amount of pain in your lower back, it should be encouraging right now for us to tell you that it does not necessarily mean there is something majorly wrong. It just means your brain has detected a level of threat that requires an output of extreme pain. So obviously it's the protective mechanism. It is an experience. It is unique to every single individual. So what one person may perceive as pain, another person may not. And there's so many things that contribute to why pain arrives. So like things like beliefs. So if you believe something's going to hurt, that you can actually program that alert system to trigger within the brain. And guess what? It hurts. Thought processes, fear. If you're scared of something, or you're really sort of stuck in that mindset of fear, and you can preempt pain. Trauma, obviously, physical trauma can contribute to the experience of pain, no doubt. And obviously previous experiences. So if you've had an experience where something hurt before, then obviously you go back into that experience, guess what? You're probably going to experience an element of pain again. So yeah, pain is like a burglar alarm, guys. Just because it's going off, it doesn't mean there's a burglar in your house. But it does mean you have to get it checked. But hopefully, by understanding that extreme pain doesn't always mean extreme damage, it should sort of trigger off alarm bells, and you're thinking, well, actually then that should make it easier to treat, and very often it is. And once you can get the patient to understand that, and you can alleviate fear, and you can challenge and change beliefs, thought processes, and stop them from preempting something that's going to hurt, you can actually down regulate and get that sort of pain experience to really dramatically, sharply drop off pretty quickly.
Yeah, spot on. I think I like when we look at the pain experience, is really important, and it's very unique to everybody. I think you've said to me in the past, if you got a boxer and punch him in the face, they might not flinch, but if you punch me in the face, I'd flinch quite a lot.
Absolutely.
So, and that's a massive, that's a very sort of previous experiences are sort of quite diverse there. They're very different.
Yeah, and over my 14 years, I've been quite privileged in sort of the type of individuals that I've been able to treat. And I've worked with a lot of rugby players, I've worked with a lot of combat athletes, and I've worked with quite a few members of sort of ex-special forces, so guys from the SAS and stuff like that. These guys, pain is radically different to the average office worker, for example. So what it takes a lot for them to basically admit to pain, so that their belief process is pain is a sign of weakness. So they actually can effectively program their brains to shut it down. Whereas somebody else, the second, like they're so they had no exposure to pain whatsoever in their life, like physical sort of elements and everything. So when you do expose them, it triggers one hell of a response. So it just goes to show you, like, from different mindsets straight away, it leads to different experiences. And then obviously you have the physical, like post-traumatic experience and stuff like that. So it is a bit of a minefield from our perspective, and we have to unravel this from sort of our assessments with you and everything. But the main takeaway point is, it's not actually anything to read. Very often, pain is nothing to fear. It's unpleasant. It's an unpleasant sensory experience, don't get me wrong. But once you start to change your attitude towards it, change your beliefs towards it, and develop your understanding to it, hopefully from a good therapist who can educate you on this, you can straight away see a relief on people's faces, and over 24 hours, their pain sensation has dropped. So at this point, obviously, we've done a good job of saying to you that there is this common belief issue, which we think is flawed. There's this singular diagnosis obsession, which we believe is also flawed. And obviously, then we've talked to you about pain, which is always perceived to be something physical, and we've just told you it's not. So it's only right if you're thinking at this point, I'm so confused, what the hell is going on? Well, that's the whole point of this presentation. We're sort of here to lay out all of those issues and kind of unravel them to you from this point onwards. So really from this point onwards, we're going to try and explain to you in an easy to digest manner what the evidence suggests and what actually is going on, so you can then think, I can now fix my problem. It's more manageable. I'm not worried about it so much anymore, and I can do it all from the comfort of my own home. So yeah, what the hell is going on? Let's start to explain it to you now. Over to you, Ollie.
That's fine. So when we talk about, obviously, this whole not a singular problem, we talk about the human body as a system and how everything affects everything else. So if we take this example here of the bones of the body, as you can see in the picture, and how these different bones affect each other, and how the position potentially of the pelvis will affect the bones above it. So a little sort of example here, we've got the position of a joint within the body absolutely affects the position of the other joints above or below it. So if we are to look at the pelvis, as we've highlighted here, how that position will affect the spine would be quite drastic. So if you were to move that, if you turned it around, for example, everything would be in a very different position. And for the purpose of today, obviously, because we're talking about the lower back, we're really going to focus on the pelvis and how the position of this affects everything above and below it. Because as you can see, the back is attached to the pelvis. We're also going to touch briefly on the rib cage and how this is affected as well. But again, we're careful, we don't want to go too down, confuse you guys too much with lots of words and lots of new sort of theories and stuff like that. But for the purpose of today, we're going to really look on the position of the pelvis and how that affects everything else within the body. So to do this, we've got to look at sort of pelvic position 101. So this simply refers to the alignment of the pelvis. And as you can see from the diagram here, we're talking about how far it sits forward and how far it moves side to side or up and down. So ideally, your pelvis should sit with a very slight anterior forward tilt. Okay, it should sit in line with your rib cage, which is what we call stacked. So when your rib cage sits on top of your pelvis, that is called stacked. And it should also not drop down on either side. So if you can imagine you to sit towards one side with your hips, or you could sit towards the other. Ideally, they'd sit nice and square, and that would all be great in a perfect ideal world.
I think it's important at that point as well, isn't it? Just to give a simple analogy there. So if you think about the pelvis, so obviously Ollie and I, we try to explain it to our patients when we see them in face-to-face contact, stuff like that. Just imagine that the pelvis is a bucket of water, okay? And ideally, that bucket of water should be, if it's full to the brim, you should only be leaking out a minimum amount of water from the front of the bucket. So the bucket is nice and stable. It's not tipped to one side, so it's leaking water out the left. It's not tipped to the right, so it's leaking water out of the right. It's not tipping backwards, so it's leaking water out the back. So the idea of this sort of pelvic position is you want to have a bucket that is not spilling any water whatsoever. But obviously posture and stuff like that, and that's in a textbook scenario in a perfect world. And we don't live in a perfect world. We live in a world where things happen, everybody's different, joints positioned differently, hips are shaped differently and stuff like that. So obviously what we're going off here is like a textbook scenario. So don't worry if you then look in the mirror and think, oh my God, I'm tipping water out the front like no man's business. I've got a waterfall coming out the front of my pelvis. It doesn't matter, as you'll soon see. Sorry, Ollie, off you go.
No, you're fine, you're fine. I think that's the spot on, actually. That example of the water in the bucket is so important because it creates a really great visual aid of what we're talking about. So if you bear that water bucket in mind, you won't go too far wrong. So when we talk about this anterior pelvic tilt, this might be something you've heard about before, or this might be the first time you've ever heard of it, okay? But as we said, the pelvis should sit slightly forward, as this angle here, you can see on the line, of the pelvis there from the front and the back. What we see in anterior pelvic tilt is when it tilts forward like that, okay? So we'll just go back. So this is what we'd like to see in an ideal world, in a perfect textbook person, which doesn't exist. Nice sort of fairly flat line. And then what we commonly see is this really steep anterior pelvic tilt. So just one more, so nice, normal, and a steep anterior pelvic tilt there.
So that person is leaking water out the front of the rocket, Ollie, right?
Yeah, they've got a waterfall going off that, as you said there, Stu. It's also worth noting that there is nothing necessarily wrong with an anterior pelvic tilt, okay? As we'll explain later, these postures are totally normal. So we don't want you going away thinking, oh my goodness, I've got a massive anterior tilt. That is my problem. That is, again, we're not looking at a singular diagnosis here, guys. This is part of the problem. But the problem occurs with this pelvic tilt is when you cannot get out of it. You are, for a better word, stuck in this position here. That is when problems begin to occur. Because if you can't get out of that position, as you can imagine, as we mentioned earlier, lots of problems are going to go on above and below this pelvis. So, but this issue is presenting more and more, and we see it all the time at work and stuff like that in our treatment rooms and stuff. And modern life does play a large role in this, which again we'll probably talk about more when we talk about the breathing and stress parts of the presentation. But for today's sort of modern life, so when you're sat down a lot as well, that has a big impact on the muscles that are active and stuff like that. Again, not demonizing sitting, we're just talking about how muscles switch off when you sit down. And again, don't worry about that, we'll come back to that at a later time. But the main point from this slide is that what is this anterior pelvic tilt? And it's when your pelvis tilts forward a great deal and you can't get out of it. So when we look at this sort of problem, there's a whole magnitude of factors that affect this problem. Sorry, Stu, say so, mate.
No, you carry on, mate. I'm absorbed, Ollie.
Okay, sorry. So yeah, when we talk about this singular problem, there's a lot going on. We've simplified this to sort of 4 or 5 key muscles that affect the pelvis here. So obviously for me, the left side of my screen would be the front, the anterior part, where you've also got your abs and your hip flexors that act upon the pelvis. And on the right side of your screen, or the posterior side or the back side, you've got the back extensors and the glutes and hamstrings that act upon the back side of the pelvis. And as you can see, you've got a bit of a seesaw effect going on here, where the really strong back extensors are pulling up and the really strong hip flexors are pulling down, which means that the longer and weaker abs are getting pulled in the opposite direction, and the glutes and the hamstrings are also getting pulled in the opposite direction. This is what creates that sort of seesaw effect. So this is what goes back to what I said at the start about how the back isn't necessarily weak. If anything, it's actually really strong, and that's what causes some of these problems. It is so strong it can't be overpowered by your abs or your hamstrings. So again, the seesaw is something really important to visualize in your mind as well. And there's a bit of a clue on what you could do to make this better, but we'll come back to that later on. But
I think from that slide as well, Ollie, sorry, that slide is clear, isn't it? Obviously, you're talking about, as you've alluded to, this, but the body is a system. So obviously, and obviously in that system, there's relationships all over the body. And you alluded to it earlier, saying that muscle groups like to pair up, don't they? So on the front side of the body, as you have here, you have the abs paired with the back extensors. And it's quite clear from this picture straight away that you've got a distorted relationship in the system. So you've got a very dominant lower back and a very sort of weak sort of abdominal system that just can't do its job against the lower back. It's a very one-sided relationship. And then below the pelvis, you've got the hip flexors becoming totally dominant over the glutes and the hamstrings. And as a result, like I said, these poor old abs and these poor old hamstrings can't gain any leverage whatsoever to act on that pelvis. So that pelvis then has got no choice but to sit into that anterior pelvic tilt. And then obviously conversely, because it's in that anterior pelvic tilt, it's positionally engaging those back extensors and the hip flexors to always be dominant. So on one hand, you've got the muscles affecting the position of the pelvis, but conversely, you've got the pelvis affecting the position of the muscles. And obviously straight away, you have a problem within the system. And as a result, the pelvis is dumping forward, which, as Ollie again alluded to, affects the hips and it affects the lower back in the fact that you get very often compression of the lower back. So this is a real sort of good slide to show you how a distorted bodily system, a distorted system within the body, and sort of abnormal and imbalanced relationships can cause compression of the lower back. So in this case, going back to the scenario, will a simple manipulation of the lower back get rid of the compression in the lower back? Maybe short term, but actually these relationships are what are driving it. So it's a really good sort of analogy. I love this slide.
Yeah, and this is where we talk about sort of that feeling of being stuck as well. You can't, because of these muscles are so strong that you can't win against them. So that's where obviously you need some help on that. So if we keep looking at this sort of anterior pelvic tilt, we'll look at some different sort of pictures and stuff as well. So we talk about this sort of chain of events, and as you work along the screen there from left to right, you've got that nice neutral pelvis there with that line. Again, this is all textbook sort of people that don't necessarily exist. But as we get into this anterior tilt, you can see how it affects the short and tight lower back muscles, the short and tight sort of hip flexor muscles, and the long and weak abs and the long and weak hamstrings. And you can imagine as well, like we hear a lot, you know, I've got really tight back, I've got really tight hip flexors and stuff like that. So these people spend hours trying to sort of stretch these muscles, which they might not actually be doing anything. Alternatively, you could be trying to stretch your hamstrings, but they're already in a position of being really stretched. So it's like an elastic band. If you keep stretching it, eventually something's going to give. And not only that, you can also see, if you look at the spine and how that's affected on the sort of middle and right picture, how it's got such a big curve at the top and a deep curve at the bottom. And that's, again, you can visually see where that compression would come from. Ooh, blimey. You can see where that compression would come from. So a little jump the gun a bit there by accident, press the button, and how that will affect everything else. So this is a really nice slide again to visualize that when we talk about this position, how the position of this pelvis can affect the position of everything else above and or below it.
Yeah, I mean, I love this slide as well. I mean, I think a lot of people, they blame muscles for becoming adapted, adapting to be shorter, when it's really not the case. So muscles don't suddenly get shorter, like physically shorter. What they do is they get put in a position where they have no choice to contract and become shorter and more stronger. So like the lower back muscles don't become short and inflexible. They just get pushed into a position where they have to be short and obviously strong. So like Ollie, again, you used a good example of the elastic band. So you can see in this scenario, particularly on the right side of the screen, that if you imagine an elastic band, the more you pull it, the weaker it becomes. So look at the abs and the hamstrings and the glutes. They're obviously getting placed onto length, so they're becoming longer, which means they have less strength to act upon the pelvis. Conversely, where on the other side you've got the shorter and tighter hip flexors and quadriceps, and the shorter and tighter lower backs that are basically put in a position where they're shorter, so they've got that good, like, strong elastic band effect. They're always going to win the battle.
Yeah, and even if you keep going out, like I said, with the spine there, you've got the deep curves, and even the neck, you can see how the chin's poked forward and stuff as well, which is, as I'm sure everyone knows, a very common issue. People have neck pains and stuff, and so this perfect posture they talk about that doesn't, necessarily exist, or isn't quite what people think it may be.
Yeah, it's a great analogy, isn't it, of the system, like one joint affecting another joint, which affects another joint. Obviously, then now if you start to see how it all sort of takes shape in the system, like you can see how it all works.
You have seen the slide, but we'll jump forward. There is a seesaw here. So what we've got obviously on the right there is sort of this seesaw, how the much heavier right side isn't letting the left side do anything. So this is kind of a nice analogy of the lower back. It's doing all the work, whilst the abs are kind of getting a free ride on the front side there, not necessarily doing anything. So nice little analogy for you guys to look at there. But this is what's going on within your pelvis all the time. This sort of backside is just overriding the front side there.
This would be somebody who's stuck in that position and can't get out of it, Ollie. So this is
no choice.
You're essentially saying this is somebody who's got a waterfall coming out the front of the pelvis, and the back is doing all the work all day long, and the poor abdominals haven't got a say in the matter.
Exactly right. They are stuck on that seesaw.
Lovely.
So this, as you can imagine, will create problems throughout the system. not just the lower back. Okay, was on here. Yeah. So as we alluded to previously there, so how many people will complain of tightness in their lower back, their hip flexors, their hamstrings and their calves? And I think it's important just to note here about the different types of tightness. Would you say, Stu?
Yeah, so again,
Yeah.
tightness, I always refer to tightness as a perception. So
Yeah.
simply because if you've got a lower back muscle that's placed in a position where it's short and strong, so it's that elastic band, it's in that short position, you may, because of the compression that creates on the lower back itself, you may say my lower back is tight. And in that sense, it is, because obviously the muscles are in a shortened position. But if you look at actually the pelvis again, and obviously look at the hamstrings at the back, if they're getting placed on length and the pelvis is dumping forward at the front and is tipping up at the back and pulling the hamstring onto a stretch, that can also create that perception of tightness, because that muscle is become longer, but it's also become tauter. So in the lower back, you've got a situation where tightness, the perception of tightness is because of compression, but actually the perception of tightness in the hamstring underneath it is because of tautness. So you've got totally two perceptions of tightness for entirely different reasons. And that's, like I say, we need to come away from that common belief issue that muscles become short and tight. They don't, and you don't necessarily need to do endless stretching. All you have to do is target the position and obviously address that seesaw issue, the one-sided dominance of a seesaw. Get them to sort of get them an equilibrium and get the relationship back between the abs and the hamstrings, or the abs and the lower back, and all of a sudden you can naturally decompress the lower back, so that feels less tight, and you can get the hamstring less taut, so it again feels less tight.
Yeah.
So I would see it all the time with people in offices and stuff like that. They're constantly clicking their necks and trying to click their backs and stuff like that. But actually, if you just targeted the system-wide issues of muscular imbalances and breathing issues and everything, then you don't need to do it anyway.
Yeah, that's a really important sort of thing to understand, is getting grips with the whole tightness thing, and how there's two different sides of that sort of equation, isn't there? Like you say, there's two different sides of that seesaw. And that's really, if you can grasp that, that's fantastic. You're really going a long way there to understanding sort of some of the things you're talking about here.
I think, we'll reiterate the key take-home messages at the end of the thing. But if you can get at this point, pain is not physical and tightness is a perception. You're doing really well at this point. And don't worry if you're not.
So after all that, we'll move on to a scenario.
So I think it's really important, isn't it, that obviously we've talked about textbook cases, we've shown you a diagram of a pelvis and all these diagrams of taut muscles, short muscles, all that type of stuff. I think if we can put it into a real nice scenario, you're really going to get to grips with it now. So this is somebody who I saw in my clinic, kindly gave us permission to use the pictures and everything, but we've kept their face out and everything. But Ollie, if you can move on to Ollie, Ollie, this is exactly what we're talking about here. So I had a patient, again, complaining of lower back pain, complaining of pain actually referring into the buttocks, and she kept saying, I can never touch my toes. I can never touch my toes. And putting socks on in the morning is a real issue. I really struggle with that. I can just feel like a deep ache across my back as I'm trying to put my socks on. And can you give me anything, as we just talked about, can you give me anything to make my hamstrings more flexible and my calves? I get a lot of cramp in my calves. And then I just happened to say, like, do you happen to get neck tension as well? And he's like, yeah, how did you know? And straight away, you don't have to be a therapist to see the huge curve in the lower back, and you don't have to be a therapist to see what's happening at the pelvis, because actually the boxer short line, Rory's best Calvin Klein's for me, and the boxer short line just shows you the direction that the pelvis is taking. And it became quite sort of clear straight away. Like, there you go, is a great little diagram for it. So if you imagine his pelvis being a bucket of water, he's got a waterfall coming out the front, and that's affecting the rib cage, because now the rib cage is popping up, which means obviously the rib cage is no longer sitting on top of a pelvis in that nice stacked position. But just look at the lower back. Look how compressed that is. Look at that deep arch. Okay, and then if you look at the front, we know that the abs and the lower back muscles form a pair. So if you've got really positionally short lower back muscles, guess what's happening on the opposite side? The abs are long and weak. And then again, underneath, you would say his hamstrings, because the pelvis is dumping forwards, it's popping up at the back, which is pulling the hamstrings onto length, which is why he's complaining of the tight hamstring perception and stuff like that. So obviously we did that. We did our assessment and everything, and we confirmed this pelvic tilt. But we also confirmed that he couldn't get out of the pelvic tilt. So Ollie said earlier, it's absolutely fine to have this sort of pelvis tipping forwards. It's not fine when you have no control over it and you can't get out of it. It's absolutely fine to have a flared rib cage. It's not fine when you can't get that rib cage to come down on top of the pelvis. And obviously, his back, therefore, because he's stuck in this position, his back all day long, the muscles are positionally engaged, are positionally strong and beating those abs. And he's got this constant compression in his lower back of the joints. And that's the problem. And obviously, when we started palpating his lower back, he was complaining of pain. We did some abs tests, we did some hamstring tests, and guess what? Because they're placed on length and like an elastic band, the longer they get, the weaker they get. We confirmed that. And we're not going to go into it too much today, but he's no longer able to breathe in the correct or the textbook manner. So he has to compensate with his breathing strategy. And instead of loading up his abs and loading up his hamstrings, he's now just basically using his lower back for support against gravity, which is basically means he's leaning on his bones. He's not using his muscles to support himself. And that in a nutshell is how things manifest. So if we move on.
Yeah.
Question time then. So how do we treat this? Do we put the blinkers on like the hedgehog and the loo roll and label the back the problem? So do we do that? And therefore, do we then massage the lower back, manipulate the lower back with a good old crack, and then obviously mobilize and sign him up to 6 months of payment saying this is the way we're going to treat the back? Or do we go after these system-wide issues and do we start to correct those one by one, those issues that we've started to see? So the drivers of the problem. So the lower back is overpowering the ab muscles. The hamstrings are placed on length and can't sort of pull that pelvis down at the front. Do we go over, like I say, and the uncontrolled compression? So the problem being, if we're going to do what we should say we shouldn't do and do a singular diagnosis, say, right, he can't get out of that pelvic tilt. So that's the root cause of the problem at the minute. Okay, so how do we do that? Right, we go after the distorted relationships. And how do we do that? We teach them how to get their abs and hamstrings back and get out of this pelvic tilt so they can choose to go into it and they can choose to come out of it. So my personal belief is it's a no-brainer. You go after the drivers of the problem and you systematically address the distorted relationships within the system, gain back control of the pelvis so he can then get out of it, get into it and stuff like that.
Yeah, having that choice is key. Like we said, it's okay to be there, but it's getting out of it that's really, really key. And as you saw an example previously there, it's fine to be like that, but it's getting out of it. And that's how we sort of try and address the problem.
Absolutely. And I think you need to come away from this idea that there is a perfect posture. There's no such thing as a perfect posture. And with time and time again, the research is saying, like, somebody who you can look at straight away and go, they've got really good posture. They might still have back pain, but if you look at somebody who's got terrible posture, according to a textbook, never suffered back pain in their life. And it's because that person on the second person may just simply have the option of getting in and out of that posture. The person who has perfect textbook static posture might have a relationship in the body that they can't control or something like that. They haven't got the options to move in and out of a range very far. And this, like I say, we need to come away from what we call posture and look at more movement variability. How much options do you have to move, basically?
Yeah. I did jump the gun slightly on that on there, but...
yeah, sorry. My bad.
The next part, everyone, just get out your seats for a minute. We're going to stand everyone up. So me and Stuart do it as well.
Yeah, we're going to do it with you.
Yeah, cool. So we're going to put your chest out as far as you can. You're going to lock your knees out and really arch your back as much as you can. And just for a second, just sit there and just tell us what you feel. I know I can feel my lower back is absolutely screaming at me. I can feel a sort of almost a stretching down in my abs there, clinging on. And just sort of, I feel like I'm just sort of hanging off my back at this point. I'm not sure about you, Stu. What are you feeling?
I feel horrible. I feel like my ribs are sticking up. My pelvis I'm leaking water out the front, out of my bucket.
Yeah.
And I wouldn't want to stand like this all day. That is for sure. The more I stand here, the more I can feel my calves, the more I can feel my lower back just compressing up. That is for sure.
Yeah. So if everyone sits down again now, we're allowed to sit down. You haven't got to stand for the rest of the presentation. So what have we just done there? So we've caused a very excessive anterior pelvic tilt. And we put muscles into a positionally weak or strong position. we pushed you forward into what we call extension and some sort of deep lower back compression. So that's where you might be feeling, as I did, a real that tightness per se of the lower back there. The muscles are really contracted, and everything is just getting compressed and squashed in that lower back. So that we made the back really strong, we made the hip flexors really strong, which have overpowered the abs and the hamstrings. So as I felt that almost stretching down the front of my abs, as they were just getting lengthened like an elastic band being pulled really taut. And the abs and the hamstrings are what we call anti-gravity muscles. So if we didn't have them, we wouldn't be able to stand up. We wouldn't be able to fight gravity. That's quite a complex sort of thing to think about, but that's what they are. They're very important in that sense. And, you know, as we've also touched on as well, muscles like to work in pairs. So if you haven't got one half of your pair, it's not going to work. So we really need them for support and sort of be able to decompress the body. So the problems will occur, obviously, when you get locked into this position. And as Stuart rightly mentioned, we wouldn't want to stand like that all the time. It takes away lots of movement options, lots of variation. It really robs you of strength and movement, particularly when bending and rotating. And you're stuck in just one direction, which is going forward. When we talk about lots of strength, actually, it's an interesting point to make there, because sort of this extension posture of pushing your chest out and really tilting your pelvis is very important when it comes to power and stuff like that. So we'll loop back around to this one in a minute. But yeah, this sort of talking about the extension is really important. We'll talk a bit more on that. Anything add there, Stu, talking about that sort of posture, what we did to people there?
No, other than, like you say,
Yeah.
if you like you say, we talk about like movement variability. So
Yeah,
for a normal human being, you want to have as many movement options as you can. So you want to be able to bend, you want to be able to rotate, you want to be able to twist and turn and everything like that. And the problems occur. The problems with getting stuck into that anterior pelvic tilt posture where your back's extended and everything like that is it actually takes away those movement options. So number one, it's driving compression onto your body, which creates problems and create back pain and everything. But also it also robs bending away from you. It bends twisting at the hips and rotating at the hips and everything. And all these things are needed for a happy, healthy body. And obviously, yeah, so, and if you're just stuck into what we call the extended posture, so you're only good at going forwards, you're not good at bending, you're not good at touching your toes and stuff like that. It's no wonder that these people in this like stuck posture then start to complain of lower back pain, neck pain, hip problems, calf problems, and all that, and like Achilles issues and stuff. It's simply because they're just stuck in one sort of position and one forward moving plane. They can't. It's not a recipe for success. Let's put it that way.
Yeah. Oh, so yeah, last comment, needs to begin to reverse these imbalances in the body. That's a where you come in.
Yeah, lovely. So we've just talked about a position, and we've just talked about extension and anterior pelvic tilt, and you may be guilty now to thinking like you can go down and put the blinkers on again. So right, anterior pelvic tilt is bad, extension is bad. Not at all. They're not bad at all. The problem is not them themselves. It's just not being able to get out of them. So it's like you said, it's like if you got stuck in that position where you're just stood up and you're driving your back, you're arching your back, you're driving your pelvis forwards and you're pushing yourself forwards. You wouldn't want to stand there like that all day. Just equally as you wouldn't want to stand touching your toes, like to stay in a position of just touching your toes all day, because if you can't get out of it, you're going to develop problems within it. Extension is actually a really, really key part of daily life. Anterior pelvic tilt is part of extension, so it's absolutely normal. And if we take a sporting scenarios here, you can see straight away the bottom picture, the sprinter. Look at that deep lower back arch. Look at the pelvis dumping forwards. And again, we've got a really good jumping picture of the athlete above. They've got, like say, again, deep lower back compression, and their pelvis is dumping forwards. Why is that happening? Because that's their acceleration and power system. Without extension, you can't develop speed. You can't jump far. You can't jump high. You need, like, extension is all of the muscle groups in the body and the position that your body adopts when you're really going for it and accelerating. So if you're a 100-meter sprinter that can't get into an extended position, the chances are you're not going to be very fast. If you're a power athlete that can't extend very well and stuff like that, and hasn't got extension muscle power, you're not going to lift explosive weights. You absolutely need extension. extension is basically the body simplifying itself so it can direct all of its movement into acceleration, i.e. moving forwards or jumping far and stuff like that. So think about extension as your acceleration and power system. And if we take a non-athletic example, if you're just an average Joe and you're crossing the street and all of a sudden you see a car speeding around the corner and you need to run forward to get out of the way of it, you need to access your extension system to do that. Without it, you're probably going to get run over.
Which isn't ideal, of course.
No, not at all.
I think also,
yeah,
like
extension isn't bad.
Yeah, cool. Well, he said in this previous slide about, we sort of said it robbed you of options. In this scenario, you don't need those options, so it's perfectly fine to use. So that's why that's the two differences. It may rob you of these, but also when you need it, that's all you need. So yeah.
And then the key is when you don't need it, you should be able to transition out of it and away from it. So extension is what we always class as it's part one of a two-part system. So if extension is one part, the other part is flexion. So if you look at the sort of GIF at the bottom moving picture, that the lady coming down, that's somebody who's transitioning when she's upright, going down, she's going from extension to bending. So think about obviously putting your socks on in the mornings. If you can't get out of extension and you can't bend forwards, but you're still able to put your socks on, you're achieving that through compensating. You're cranking on sort of parts of the body now that shouldn't really be cranked upon. So if you can't access your flexion system, but you're still achieving putting your socks on, you may well be putting excessive pressure on your discs, and you may well be putting excessive pressure on muscle groups and stuff like that. So a healthy body is a two-part system. You need to be able to extend and you need to be able to flex. And the reason for that is flexion is your braking system. So if you're an athlete and whenever you sort of slow down or sort of change direction, you have to go through flexion to be able to do that. If you're an athlete that's stuck in extension for reasons I won't go into too much today, you're an athlete that actually can't recover. You need to be able to access flexion in your body to be able to recover well. For breathing purposes and shifting your central nervous system, but I'm not going to go too much into that today. So what I will say is if you cannot recover, if you're an athlete or you're a person in general life that cannot recover, cannot break or simply flex, at some point you will break down because you're having to achieve normal daily movement patterns through compensation.
Yeah, I think as well, when we talk about flexion extension, we're not just talking about the lower back, we're talking about the whole body.
Oh yeah.
Again, this comes back to that point there, like what Stuart was alluding to about cranking on your back. If you can't flex anywhere else, you're going to flex through your back, and that's what can cause the problems. So it's all well and good, sort of like bending and stuff like that, but it's about to bend throughout your whole body, isn't it? It's not just in the back. That's where you can get
absolutely
from it.
If you look at the pictures there, then so look at the guys changing direction. It's not just their back that's bending; their hips are bending, the knees are bending, ankles are bending, and the lady, she's doing her roll down. Again, her knees have to go into a degree of flexion. Her hips definitely do. Her lower back does, upper back does, neck does, head does, and everything. So we talk about flexion as a global thing. It's not just bending at your back; it's your whole body, and that's part of what we look at when we assess people.
I always think it's quite interesting as well, like obviously watching sort of sprinting and stuff like that. When you watch, I don't know if you would have seen the 100-meter sprint where Usain Bolt pulled his hamstring, and watching him trying to break without a hamstring, you can't. It looks like he's been shot. He's like hopping all over the place trying to slow down. It's just that's how important sort of this bending and hamstrings are in that scenario there. They are your brakes. They all stop you. If you lose one or it gets hurt, then you do all sorts of strange things and jump on the floor to get out of it. That's quite interesting to watch. If you watch someone pull their hamstring, it's not nice, but it's fascinating what the body does to try and get that person to bend over. So we talk about sort of very deep extension, and a player that's always sort of I find very interesting if you're into football is Raheem Sterling, and just looking at his posture, you just have to question how does he actually work. A bit farther, you can see how deep that pelvic tilt is. So he's a great example of somebody who, because of the type of player that he is, he's a very, very fast attacking player in football. He plays on the wing, so lots of change of directions, but he very rarely picks up injuries, which to my amusement is what we believe is due to the fact that he may be like this, but he can get out of it. And that's the real big key. He needs this type of posture to be as fast as he is, but he can also get out of it very quickly to change direction.
Yep.
And he's one of those players who's got a very fascinating running style and all sorts. He's got all sorts going on with his arms, but he is very effective as an athlete and as a player. And I think he's fascinating. Yeah, very good player indeed. It's fascinating.
I just think, yeah, it's again, isn't it? It's just a classic case of the textbooks say that he can't work. The textbooks say that that's an extremely bad posture. And obviously, it just shows how dated that principle is now. Yeah. His posture suits him down to the ground. It means he's able to simplify his body and access sudden bursts of acceleration very, very rapidly. But he doesn't break down because, like as Ollie said, his abdominal muscle and everything. He's obviously got very, very good control over his position. He's obviously got some very good medical staff behind him, some very good physios and doctors and sports scientists and that have enabled him to basically have good movement variability, and that's all it is. And like I say, he's just a fine example of how you can't pigeonhole people and get the blinkers on and go, well, that's bad posture, or that's it's looking at the body as a system. His system's obviously they've figured it out. He's able to operate very, very, very effectively, and good on him.
Yeah, and also just on the playback there, we lost connection to Stu there, and he went really, really quickly. That wasn't planned, but you can still understand him. He went quiet and he went like a million miles an hour. Cool.
Fantastic.
So when we look at the pelvis,
accessed extension in my voice.
You absolutely nailed it. Talk about speed at the fastest speed possible, which is quite ironic. So when we talk here then about the pelvis, so go all right back to the start of this and look at the problem as such that we presented to you all. The back extensors and the hip flexors on the quads are overpowering the abs and the glutes and the hamstrings and causing this very deep seesaw. So I think this is one of the sort of most important problems to address. And what would you say is a solution here, Stu?
So basically the solution is, again, it's a chicken and egg situation. Do you target position or do you target the muscles? It doesn't really matter, because the solution is quite simply to get this pelvis to have the options back. And that's how you do it. Simple as that. You target muscular groups, the distorted muscle relationships in the body to become more sort of equilibrium based. So abs and hamstrings, particularly the hamstring, we'll go on to in a second. People get obsessed with glutes, don't they? Like, you've got to target your glutes. You've got to target your glutes. Believe it or not, hamstrings over glutes in the early stages. When we identify this, we have kind of a system that we use, which gives us a range of exercises that will enable us to start working with the patient to get their abs and their hamstrings back, and obviously restore a balance in that seesaw and get them to basically stop leaking that waterfall out the front of that leaky bucket.
That's it. It's all about getting that leaky bucket to stop leaking.
That's it. Ollie, go away. You can take this one, mate.
Yeah, so again, just using that, visualizing that pelvis, the core and the hamstrings are what we use to try and reverse this and try and restore that optimum position for the back and for lifting. So getting those two main muscle groups to pair up as such and overpower their rivals, if you want to call it that, is how we really work together and get this sort of as a way to sort of find a solution to this problem. So they are what cause this pelvic tilt to reverse. They are the exercises target these muscles for strengthening. And not only that, this also allows the back and the hip flexors time to relax, because as Stuart said right at the start, if the back is a victim rather than the culprit, by asking it to do more work, is it going to fix the problem? Potentially not, more than likely not. So by allowing it time to relax, by getting this core working, getting his hamstrings working, you can see some great sort of improvements almost instantly by doing some of this stuff. It's truly amazing.
Yeah, I mean, I think my wide take-home message is the body is a system, and the body's designed to work effectively in that system. So when you start to do the right things, once you've identified the key drivers, so if somebody's stuck in this anterior pelvic tilt, and you start to get to grips with the abs and the hamstrings, the body works very favorably with you as a therapist and as a patient. Good things happen very, very quickly because the body wants to be decompressed. The body doesn't like compression; it wants decompression. So the second you start to get the abs working, the lower back muscles have to shut down. The second you start getting control of that back of that pelvis and getting a stuck person unstuck, obviously good things happen very, very, very quickly, very quickly.
Yeah.
And in my opinion, definitely, and I know my experience supports the evidence definitely, that it's far superior to any manipulation, far superior, and far quicker really in a long-term effectiveness. So one thing I will say is, however, like I think everybody has been sort of had it rammed down their throats over the years that core. If you've got a back problem, you need to train your core. If you've got it, you need to do your abs. You need to everything revolves around the core. But as we've shown you today, the abs is only one part of it. I mean, below the hamstrings have a profound effect on the pelvis, even more so, believe it or not, than the abs themselves. So it doesn't matter how strong your abdominals are, particularly when you're standing up. If your hamstrings aren't pulling that pelvis down from the back, the abs haven't got anything. I mean, Ollie's he'll show you in a second. Not yet, Ollie. I know you're waiting for this big drum roll moment. But yeah, so think about hamstrings as reins at the back of the pelvis. They're the muscles that rein you to the floor. So when you're stood up, your hamstrings are absolutely vital to gaining control of that seesaw at the back of the pelvis. The glutes can't do it. It's the hamstrings that have to do it. And if you see how, if you look on this diagram here, you've got the hamstrings are really, really long muscles, and they are literally like reins. They will rein you to the floor. Once you've got your hamstrings doing the job of the reins, the abs can work all day long. And all of a sudden, you've now got a back that is not decompressed. It is not compressed. All of a sudden, you've got lower back muscles that are no longer short and tight and engaged. Everything is now equally, like everything is working as a team. You've got the abs in a better have got to improve their relationship with the lower back, which means there's no lower back decompression. You've got the hamstrings taking control and reining you to the floor, which means they've now improved their relationship with the hip flexors and the quadriceps, and everything starts to be hunky-dory. So it doesn't matter how strong, I know you're waiting for this, Ollie, the core is. Without the hamstrings, go for it, mate.
They've got nothing.
Yeah.
And also, I think it's really great. We spoke about how muscles work in pairs, and we've sort of presented you with sort of 4 groups of muscles, if you could call it that. And as Stu said there, if you target just 3 of those, that's not complete the picture. You're still missing that important one. So that's where, like I say, when you think about the pairs, it's always pairs with muscles. They always work as a team. So, like I say, it's restoring that balance within the team that's just so important, really.
Yeah, and I think it's like I say, we've broken it down into that. We've grouped those groups.
Yeah.
Very, very sort of general. Obviously, you've got as part of the abs, you've got the diaphragm, which is a crucial muscle. You've got into the shoulder. There's another muscle called serratus anterior. That is a crucial muscle. So we're being very, very general with you here. But just obviously for today.
Yeah.
But yeah, no, that's it in a nutshell. So these are some of the exercises that we may give to people to take back control of their pelvis. So obviously, it's me doing an exercise with Ollie. We call this the Levitt lift. So this exercise we absolutely love, and we get people to do it as quickly as possible, where possible, because it targets the abs and the hamstrings at the same time. And if you can see here, if you imagine that Ollie's one of these people that's got a sort of, you see you've got a good arrow there, Ollie. One of these people that haven't got the option, they're stuck with their pelvis leaking water out the front. And if you look at their pelvis in this position, we've now got them to get their pelvis to go backwards. We've stopped the leaky bucket, and we've done it by using the hamstrings predominantly, and then through a cheeky little exhale, we've got them to use their abdominal muscles. So in that position, Ollie's hamstrings are working, his abdominals are working, and his lower back is off and decompressed. You know, somebody who just lives in that sort of compressed lower back, and imagine when we alluded to earlier, we've got you to stand up and drive yourself in, like chest up and pelvis forwards, and all of a sudden you feel like your lower back. This is a great way to decompress that.
Yeah, and I want to say here, you do feel your hamstrings.
Oh God, yes.
They are working hard here.
It's amazing for those people.
Yeah.
For those people that have not, who've been stuck in an anterior pelvic tilt for a long time. Goodness. You get them to find their hamstrings. Boy, oh boy, do you find your hamstrings?
Yeah. They are weak. they need some help. So this is one of the exercises here. Then the next exercise we've got is a lazy bear. We've swapped obviously here somehow. It was quite impressive. But yeah, so again, much like the previous exercise, we're targeting the abs and the hamstrings here. And we've obviously flipped Stu round. So he's very much in the same position with the sort of that all fours position there. But this sort of exercise puts more emphasis on the abs to work. You do still feel the hamstrings, but this is primarily more ab related. And when we talk about the breathing as well, that comes into it. As Stu called it, a cheeky exhale is what you use here. So a real complete exhale really gets those abs working.
And I think here it demonstrates it better, doesn't it, Ollie? How when I'm in this position and I'm exhaling on the hamstrings, you can see the lower back is no longer compressed. The deep arch is gone. The abs are now restoring their relationship with the lower back. And it's a lovely. These two are lovely exercises when you get them done right.
Yeah, and these are exercises that you both find in our guide as well, which is really important.
I mean, I have to say that they're two of many, but they're probably our go-to. As the guide alludes to, these are two of our go-to exercises.
Exactly right. So obviously this is kind of coming to the end of the presentation now, guys. So we've just got a couple of take-home points really for you to take home, I guess. So the body is a system. So we've got to make sure we take those blinkers off. We don't want to be looking at things with the blinkers on because you're not looking at all the options. You know, the body is a system. There's a lot going on. We can't just focus on the back or just focus on the knee or the ribs or whatever. You have to look at it as a global thing and ensure that everything is looked at, everything is checked. Pain is an output of the brain, as we spoke about before. You can always go back and watch any of this again, guys, but pain is an output of the brain. It's a unique experience to each individual person. No two people will feel pain the same, nor will they react to the same inputs on the body the same. We need to focus on position. Position is really, really key. And this sort of moves away from that singular diagnosis and really looking at the position of everything and how it all interacts with itself. Again, this goes back to the body's a system. Look at the position, focus on that position. And once you get that, you'll find things become a lot easier. Extension isn't bad, but not being able to get out of it is. Again, this just highlights this whole positional issue in the body. And how extension is not bad. It's not the enemy. It is not. But being stuck there will cause you lots of problems. The core and your hamstrings are your friends. They're your best friends. If you have a really strong core and a really strong hamstrings as well, you know you've got a good control of your body, and the whole system should be working nicely. That's not to say that just focus on those two things, because again, that's going down that path of focusing on one or two things. The whole body's a system. Make sure everything is equal as possible, and I think you'll be on the right sort of track. Anything to add to there, Stu?
No, not really. I would just say that it's key points for me that aren't on the screen. I would just remind you, like say, obviously this one is on the screen, but pain is not physical. It's an output of the brain. So when the brain detects a level of threat, it can produce pain as an alarm system. It doesn't have to be damaged for that to happen. Just remember that perfect posture doesn't exist. Posture is not a static thing. So people say, anyone tells you to sit up straight and do all that sort of stuff. It's a very dated concept. But like, you need to move away from this sort of idea of perfect posture and just more think about, what options do I have to move? If my options are limited, then the chances are I've got problems through compensation. If I've got very, very good options, and obviously, like say, honestly, I said high functioning core and high functioning hamstrings, you're pretty much cooking with gas. And just remember that everything affects everything. So the position of the pelvis affects the lower back, and it also affects the hips. It also affects the position of the ribs. So you can just see how that domino effect can really start to sort of take effect once you start compensating, and if you limit your movement options, like it really does have a domino effect. And like so, this whole extension, we've heard about extension being bad. It's not bad at all. And I for one, I remember a lot of good work coming out by Professor Stuart McGill many years ago. And people joked where he said about our flexion and disc problems and stuff, and people jumped on the bandwagon that flexion is bad. You can't flex. So a lot of people were sort of trying to hinge through their hips just to brush their teeth in the mornings, and they'd do anything not to bend and not do sit-ups and stuff like this. It's absolute nonsense. You need to be able to flex. You need to be able to extend. You need to be able to rotate. and you need to be able to accelerate, you need to be able to decelerate. The more options you have, the better you are. If you start limiting those options, that's when things start to go wrong. And if you start then, as a case in point, if you start to tell people that extension is bad or flexion is bad, guess what you're doing to the brain? You're putting negative input into it. You're changing their thought processes, you're changing their beliefs, and all of a sudden that then plays into pain. It plays into the output of pain. You know, so all of a sudden now you can actually coax someone. You're trying to, your intentions might be honourable, but you're now coaxing someone down a road where they may experience pain. There's nothing wrong with them, but they may experience pain. So everything affects everything. Options, more options are good. Obviously, core and hamstrings are your friends, and just try and sort of never try and think this something is good or bad. Just try and sort of relax about it and just think, right, the more options I have, the better, and good things happen with options, and it's as simple as that.
Yeah.
And yeah, I like this one because obviously it's like a funnel to back pain, isn't it? So if we take today's presentation as a case in point, we know that distorted muscle relationships, you chuck that into the mix, you've potentially got a problem. We also know that if you add in stress to the mix, because stress drives certain positions within the body, that can become a problem. And then obviously these between the two, stress and distorted muscle relationships, affects your breathing patterns, which guess what can contribute to positional problems and back pain. Throw into the mix as well, so like we just alluded to, like thought processes, belief systems, and all this type of stuff coming in from the side. It can all contribute to the back pain experience. So it's not just a single thing. It's not a singular diagnosis. And we need to really challenge this common belief issue that, I have a back problem, therefore I need to strengthen my lower back. No, there's so much more to it than that. And as long as you get to see a therapist that is aware of all of this and has systems in place to assess all of this, you don't really need to worry. Like that, these problems can be eradicated very, very quickly in the right scenarios. I don't know if you want to add into that, Ollie.
No, exactly right. I think that was spot on. That sort of the back pain experience. I think, that must be like the worst sort of theme park ride ever, back pain experience. But it's certainly a great way to describe it, because it is an experience, and you could go through the exact same thing as somebody else, but you would experience it completely differently.
Absolutely, yeah.
And that comes back to pain. That comes down to the muscular relationships, the stress, the breathing, all that sort of stuff plays into it. And it's a very fascinating. Like back pain is a fascinating topic in itself. But like I say, we're just trying to get you guys just to look at. We're trying to break it down as simple as we can in sort of these three primary topics. And obviously, in the next part of the presentation, not right now, another day, obviously, we'll give you a rest. We're going to talk about stress and breathing and how that really impacts it. So that will form part 2 of this presentation. We'd also like to plug our Back on Track guide here as well. You've watched this far, so you might as well download the guide as well and have a read of that.
I think the back on track explains it a lot.
Yeah.
It flows a lot better than what we've done today. Because obviously, me and you have been jumping in and out, Ollie. So the back on track guide, it talks about everything we talked about today, but also it includes the stress and the breathing, and it talks about all of that and how you can how things manifest, but also how you can undo the stress and the breathing through, like I said earlier, the cheeky exhale and stuff. But it also gives you a really good starting point. If we know if we can improve a patient's education, if we can educate them as to what pain is, as to sort of position and stuff like that, we know their experience of pain definitely drops for the vast majority, because it removes the fear, it removes these negative thought processes going in. And then if we can start sort of restoring the relationship between extension and flexion, getting the abs going, getting the hamstrings going, then we can do it like very, very quickly. Good things start to happen with regards to that person's back pain experience. So in that guide is our top 5 exercises for that. I mean, obviously they're just our sort of top 5 go-to exercises. We're big advocates of giving you individual programs and stuff if you come to see us and everything. But I think it's a really useful guide, and we've made it free at the moment. There's no charge whatsoever. It's downloadable in seconds, and it's really, really good in that.
Yeah, and we'll pop the link on with this video so you can download it as well. It's nice and easy to get access to.
Yep.
Yeah. We've also got a blog as well. We talk about all things back pain, stress, injuries, all sorts of stuff there. The Tier 1 therapy blog, which again we'll link out to if you to have a look at. And if you have any questions, obviously, you can ask us, you can email us on the email there, or you can contact us on the social media pages. You give us a call on the Tier 1 number, which off the top of my head I've forgotten. Stu?
Sorry, say that again, mate.
The Tier 1 number, mate.
01604 231 201.
Yeah, so that's it. Perfectly memorised by yours truly. But you'll be able to give us a call. We can answer. If we can't answer straight away, we'll get back to you and answer any questions you have. But yeah, we want to help you guys, and we're trying to just provide you as much information as we can to help you make the right choice regarding your back and make sure you're going to get the right advice and get the right help. That's the key, isn't it, really, Stu?
Absolutely, yeah. And like you said, remember, you're not alone. 80+% of people are experiencing or have experienced what you may be going through. So obviously, we just want to be a good reach out point for you. So even if you, obviously, at the minute, physical appointments, we have to sort of jump through hoops to get to see people face to face because of COVID and everything. But if you do need anything from us, like we do online sessions, we've got a virtual clinic. We are obviously doing face to face stuff, like limited stuff at the moment. And yeah, but we can just answer any questions you may have. No questions ever too stupid, guys.
Yeah, exactly that. Well, we thank you all for watching, and we look forward to seeing you, hopefully, to watch part 2 if you enjoyed this one. Please leave us any feedback or advice, or anything you've got on the presentation. We really, really appreciate it. We're fairly new to all this as well. So yeah, any feedback's appreciated. So thanks for watching.
Thanks for watching, guys. And obviously, on your next slide, that's all, folks.
Oh yeah, there's one more slide. My bad. That's all, folks. It took ages to find this GIF as well.
Listen, for any of you that are watching and have stayed this far, we really appreciate it.
Yeah,
and we genuinely care about what we do. So we hope it helps. And like I say, we are here. Just reach out, guys. If you need anything at all, we're here to help. Happy to help as well.
Yeah.
Thank you very much.
Yeah.